Inactivating mutations in NPC1L1 and protection from coronary heart disease. What is ezetimibe? Ezetimibe, a drug that is commonly prescribed to reduce plasma levels of low-density lipoprotein (LDL) cholesterol, inhibits the function of the protein coded by the NPC1L1 gene. NPC1L1 protein. This protein, which is expressed in the small intestine and liver, functions as a transporter of dietary cholesterol from the gut lumen into the intestinal enterocytes. Naturally occurring DNA sequence variants in humans that detect the activity of one or more protein targets can be used to estimate the potential efficacy and toxicity of a drug targeting such proteins. We test the hypothesis that protein-activating mutations in NPC1L1 reduce both the LDL cholesterol level and the risk of coronary heart disease. Conclusions. Naturally occurring mutations that disrupt NPC1L1 function were found to be associated with reduced plasma LDL cholesterol levels and a reduced risk of coronary heart disease.
Hello, Paul Zollinger-Reid. I'm the Chief Medical Officer of Bupa, and I want to talk to you today about heart disease, specifically how to prevent heart disease. Now, your heart is a muscle, but just like any other muscle, it needs a supply of oxygen-rich blood to work properly. It receives its own blood supply through the coronary arteries and their branches which lie on the surface of the heart. What happens in heart disease is they silt up. They get these things called plaques in them. Now, if they generally silt up, then people can get what's called angina, chest pain, which typically comes on when they walk up a hill or they eat. But occasionally, you can get narrowings that then burst. Those plaques rupture. And then an artery gets blocked and you have a heart attack. But what are the things that create and cause and aggravate heart disease? And if we look at them in turn, smoking is probably one of the most significant factors. Absolutely no doubt about that. In fact, when the smoking ban was brought in public places, we saw a really significant fall in the incidence of heart attacks. And that happened within 6 to 9 months. So we know smoking causes heart disease and can precipitate heart attacks.